Good evening, Facebook world. How are you all doing? Fabulous, I hope. All right, we are waiting. We're going to be interviewing Miss Kirsten and her journey. She was just recently diagnosed, and I actually met her in a Facebook group and have been following her and her journey because she's been sharing it with us, and it's been exciting to see. So I wanted to hear her story. Okay, let's bring her on. Oh.
Is it working? There you are. Okay, will this show on my page too?
Yeah, so I see your face.
Will it show on my page?
Yeah, I tagged you in the class. But you have two things up right now? I hear yourself.
No, it's probably just the speaker.
Okay, hello?
Yeah.
I'm hearing yourself twice.
It might be my speaker. I don't know.
Okay. I'll try not to do a lot of talking.
No, you need to.
Okay, so this is Kirsten.
Yep, Kirsten.
You don't hear that?
No.
Jolene, do you hear that? Hello, Anne. Do you hear the feedback? I just want to make sure. If it's not bothering anybody, if it's just me, then we'll get going.
Yeah, is this that?
Okay, so I already. I said that I met you in the Facebook group, and this is a new journey, a new work. And so I wanted you to come on and kind of talk through the story before your diagnosis and sort of transition into what made you decide what so and what that is looking like.
Okay. Can you hear me okay?
Yeah.
Okay. So basically, when I went in to the doctor, I didn't go in for any bump or anything. I went in because I was having problems with my ears. Like I constantly had ringing in my ears, and then my vision, when I was watching TV, and my vision was messed up. And so I thought maybe I'm just, I'm over the 25 limit now, so maybe I'm just getting a little older. But then it started I was having a lot of bad ear pain, really super bad. And finally I went into the doctor. I got a referral to go to an ENT. And after that, they told me, everything looks fine, nothing's wrong. It's all in your head. So then I went back to my regular doctor, and I was like, okay, this is what they said. I'm still having problems. I'm having pain. Something's wrong. So he gave me a referral to upstate, an hour north of me, and they checked my ears and everything, and so they were fine. And then as the exam went on, he felt, the mass in my neck, and said it's probably nothing, but we need to ultrasound it, and then we'll, go from there. So automatically then, you hear mass and you're thinking cancer automatically, just the way it is.
Yeah.
And so I was already getting in line right then and there. All right, okay, what do I need to do? If this is, I'm a mom, I gotta have everything in line. So from there, I was like, does this mean I'm gonna have to go through radiation or chemo? Like, I don't want to end up like that. And I started looking up out of nowhere alternative, cancer research. And pretty much from the point on, I knew that I was already standoffish about chemo and radiation. So I started, doing the alternative, typing it on YouTube and, on Google and stuff. And I was like, oh, there is alternatives. There really is. And then you start reading into like the Cancer Tutor and, Crispy Cancer and all these different people, and then finding out that, doctors are being killed for helping people. It kind of puts things into perspective that there really is there is healing and there is people being cured from cancer, but they don't want that shown for a reason. And it all puts into perspective. And then you kind of piece the whole world together almost. Like, you kind of have to fend for yourself. And so basically after that I had the biopsy and confirmed it, and then I already was starting my change of diet. I had started supplements, like 50 bottles of supplements, and with the diet I do the raw fruits and veggie diet, and no sugar, no GMOs, no dairy, no nothing. And then I had another appointment. They wanted to make sure it wasn't in the lymph nodes, so they had me come in for another biopsy. And those biopsies, y'all, those are not fun. And it confirmed that it was actually my lymph nodes and was stage 2. So yeah.
So what did it look like then they approached you about treatment, and you had already started some proactive measures?
Yeah, so once it was confirmed cancer, and I had to go in there in the doctor's office, and he's like, okay, yes, it is cancer. He transferred me off to another doctor, and it was a mess from there because there was like 4 different doctors calling me. I guess, I don't know, I feel like it's almost like they fight over a case, because I had like 3 doctors like, hey, you were referred to us, and I'm like, okay, I don't think so, but I was referred to one doctor and I didn't like his reviews, so I went to another doctor, and immediately he was like, well, you are in stage 2. We're going to have to cut from your ear right here all the way down to your throat, and possibly on this side back up to your ear. So I'm just like, okay, you know, and then he's like, you're going to have to do radiation. So you'd have to go into isolation for, I think it's a week, 2 weeks, depending on the dosage. And I was like, no way.
Well, you denied come across all this stuff on.
Yeah.
So did you have support? Because I feel like that's a because you're doing this stuff. What about your?
Yeah, basically my husband's like my biggest supporter, because he was the one that, like, when I started showing him all this stuff, and he was like, you know, this all makes sense, and you know, he's actually more supportive than I thought he would be, because he is so like, you can do this, you've got this, and he's completely against surgery. Like, I'm gonna be honest with you, my surgery was supposed to be yesterday, and he was like, you're canceling the surgery, you're canceling it. Even when I was like on toes, like, maybe I should just get the mass cut out, and no, you know, it makes it spread, no. And you know, he's done so much of his own research, and which is really awesome, because you know, we're both researching it, we research together. And he's just like, you're not doing any of that. Like, radiation's not even an option. It's not happening, obviously, because, you know, it causes cancer to come back, in leukemia, and especially in my case, leukemia is a big factor. And yeah, so basically he is like always there, you know, telling me, you're going to beat this, and you're not going to do you're not going to do, you know, surgery. You're not going to do radiation, and definitely not doing chemo. Like, none of those things are even an option in his mind. So basically, yeah.
When did you get diagnosed?
Well, they suspected it in June of 2018. And then they did the ultrasound, which showed that it was basically, they scale it, you know, 1 to 5, and it was a 5. So it pretty much knew it was cancer then, which was July. And then the actual biopsy that confirmed it was August, I believe, August or beginning of September, but we already had knew it then, because of the ultrasound kind of scales it high. But the biopsy like determines what type of cancer it is. And so people think that with thyroid cancer, like, oh, you're going to beat it, but there's different types of thyroid cancer. Like, there's different codes, like, you know, TTF1 and PAX8, and those determine whether or not the cancer spreads. And so, like, people are like, oh, you know, thyroid cancer is not a big deal, just get it cut out and you're good to go. No, it's not like that at all. Like, clearly with me, like, it had already gone to my lymph nodes, and who knows where else from there, because once it's in your lymph nodes, it's like your body's highway. Like, it can go anywhere from that point. So that was really scary. I'm going to be honest, when I found out it was in my lymph nodes, I was extremely nervous. I was like, what do I do now? Like, now things are getting serious.
Yeah.
But yeah.
So you found out in August, started changing your diet, starting stuff prior to August, or was it
No, as soon as he told me that there was a mass, I was like instantly like changing my diet, organic, raw fruits, veggies, and no sugars and no soda, just water, water, water. And now
So that was
yep, yep. And then now like my treatment has changed each month. I add things to it, and I take things away. But this this month I started was the Kangen water. Are you familiar with that? Yeah, I started.
not
Basically, it's a giant machine, and you can alkaline your water to first you start out at 8.5, then you go up to 9.5 after that week, and then 10.5, and some cancer patients even go up to 11.5, which really alkalines, you know, the body. And I started that. I'm on 9.5 now, and I should have brought my water up here, but whoops. So yeah, and basically, there's people who are being healed just from the Kangen water. Like there's for throat cancer. Like, you know, like me, people have cancer in the throat. So it's just crazy because
so I know that you've been taking in food and supplements and water. Stuff you've been taking because we want to report on how the healthy supplement.
yeah. So I use these patches, and they have colloidal silver in them. They have seaweed, and I get them from Europe. I don't get them from here. I have to have them shipped over across these, and it helps. I think these have helped a lot. I always have them on, and they help with the inflammation and I guess pain or anything. But I notice a lot less swelling. Like my nodule is not very, very swollen anymore. Also too, I'm doing IV therapy. And basically what that is, I go in twice a week, and they do the ozone and the oxygen for your blood. They draw your blood, take it out, put oxygen in it, and put it back in you. Then they do high dose vitamin C. Excuse me. Then they do the Myers cocktail, and they do the glutathione, and then they also have the PEMF mat, which is, are you familiar with the PEMF mat? You lay on it, it's supposed to help like the cells in your body, like a reboot kind of thing. Yeah, and then they do a sauna every 4th week, the infrared sauna, and a couple other things that they put in an IV in there.
This place sounds like it's a healing with cancer.
Lyme disease and cancer, yeah.
Okay. Is it someone
close to me?
Yeah.
It's about an hour south of me, so I drive twice a week to go.
Okay. That's not too bad. And do they do any or do you go to an oncologist hospital?
That doctor there can order lab work for me, which he has. As far as like scans and all that, usually that's like the other doctor would order that.
Okay, somebody is asking
Asking what?
Where you can get the Kangen water?
Oh, Kangen water. Oh, if you Google on your phone, Kangen water store near me, easily, it will pop up a location. Like mine is 30 minutes north of me. And they, you can ask because they usually offer discount, like $25 a month. If you can't afford the machine, because I know it's expensive, they will offer you like a monthly rate. Like I pay $25 a month, and I can go in there and get as much water as I want for $25 a month. And
that's awesome.
Yeah, because I know it is an expensive machine, and some people can't afford it because they range from different prices. $25 a month, and I can go in there each week and change my pH and and get as much water as I need.
And so that's a few $100. What they cost, like for that machine?
The Kangen water ranges $3,000 to $6,000. I know the main one's like $4,900.
Okay.
Which I would have done, but my IV treatments was $9,000. So
and this is correct.
What?
It's not covered by insurance.
No, it's all out of pocket. Insurance will not cover any vitamin therapy at all whatsoever. And it's crazy because why would they not want to help you if that's what's helping me, you know? Like, come on now.
It is a very sad reality that a system that does work that was not covered by insurance, profitable, but they're in the profession of health. So my mind is very contradictory. So I am curious what is the lab saying.
What is I don't have the you mean my scan?
Yeah. So what
okay. So I had a biopsy in September of my lymph node that showed that it had traveled to my lymph node. Then that was in the beginning of September. Then end of October, it was the day before Halloween, I went in for a CT scan with contrast. And they wanted to see, you know, if it had spread anywhere else because surgery, because I was still uneasy if I was going to do it or not. And so when I went in there, I was expecting, you know, oh, hey, it went to this tissue and that. But when I got the call, which I posted on Facebook, saying that there was no evidence of any further spreading, good to go, continue on with surgery. Well, then the doctor left a voicemail to me saying, hey, I want to talk to you about your scan. There's a couple things I want to talk to you about. It's good news. And then I didn't hear from him till the next day. I got a copy of my CT scan before he called me back, which showed, oh, I wonder if I could read it. Darn it. It's on my phone. It basically stated that the CT scan that they did showed that the patient had thyroid cancer and lymph node cancer in the left cervical lymph nodes. However, it is no longer present. And then it said, when I read that, my stomach was like, what? I was like, wait, am I dreaming? Like, hello, wake up, what's going on? Like, for real? What? And then it said, no other cancer in any part of the soft tissue or the soft tissue spaces. And it said that, but I don't know if I mentioned this, but there was 4 masses in my throat, and there was one on the parathyroid gland, which they were concerned about. It said that there was no tumors at all except for the one left, the biggest one. Said no tumors, no evidence of any parathyroid adenomas or anything like that. It said none. It kept going on how the trachea was normal, how tissue was normal, everything was great. And then it stated that there was, you know, the mass in the neck, consistent with thyroid cancer, not out of the ordinary, nothing we weren't expecting. The original 3 scans showed that it was 2.4 centimeters. This scan showed that it was 1.4 centimeters by only 0.7, which is significantly smaller, and I can feel it. Like, it doesn't seem to be protruding as much anymore. And when he called me back, I don't know if we want to get into all that, but he basically stated that my CT scan was false and that the radiologist missed some things, and I had let him know, well, if they missed things, then you should probably have it amended so they can recorrect it and give me the right scan, but he said that wasn't necessary. I said, okay, well, I stuck with a false CT scan then, and he's like, well, we're just going to get the surgery taken care of and not have to worry about any of that, and okay. Well, thanks. Yeah, so that's how that went, but.
So did you find a new doctor?
Well, he's gone. He ain't gonna be my doctor. He ain't cutting into my throat.
Yeah. And so you have yet to have the surgery. And I assume you're just gonna be continuing on with things, but more stuff as time goes on until the last one's gone, correct?
Yep. Absolutely, yeah. And I got nervous because my first treatment that I did with IV, I had a very bad reaction. I honestly thought I was going to die. I came home and I immediately walked in the door and I collapsed on the floor. I could not get up. My body wouldn't move. And it almost like was like I blacked out because my heart started thumping and I could hear it in my head, like thump, 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 thump. And I started getting really sick, and my husband had to take me to the hospital, and they had to rush me in because they took my vitals and my heart rate was like 153, and my blood pressure was like 80 over 53. It was really low, and basically I think that was a healing crisis, if you can Google it. But basically I think my body like rebooted, like all of that was like a reaction for the good. But and that was a scary day because I've never like experienced that type of sickness in my life. Like I was just like I couldn't even move, like my body was so weak. And then I was like, what happened? Did I react to it? And then I was so afraid to go back. I can't believe it, because when I went back a couple days later to have the next round of treatment, I was so scared. I was like, I don't want this to happen again. Like, oh my goodness. But I ended up being fine, and fine again, and fine. I'm still going on 7 treatments now, and I feel great. I have energy. I'm starting to feel almost back to normal, not quite, but I'm feeling pretty good for, what's going on.
Yeah. I think that when you come to the body, that's how it acts like that. Because you aren't as healthy as you thought you were.
Right, yeah.
So I'm kind of curious, what kind of lifestyle were you living
Before all of this,
before you got?
before all of the mass and everything, honestly, it was awful. I didn't care. I ate out all the time, and I was extremely addicted to Pepsi. I had to have a Pepsi in the morning. I had to have a Pepsi after breakfast, lunchtime, about crack open 4 more in between lunch and dinner, nighttime, drinking. I would go through a 12-pack a day myself. It was so bad.
Wow.
It was bad. So now I look back, and that's like a lot of acid in the body. Like, no wonder my body, I'm surprised I don't have anything worse, because, that's a lot of harsh stuff I was doing. Never did any like drugs or anything like that. I wasn't on anything like that. But I just really like drank so much soda, ate out all the time, and I never really liked a lot of meat though. But like my body was surviving off of Pepsi and junk. There was nothing going into my body that my body, I didn't take care of myself, and of course I regret that. And now I'm very extremely cautious, like, and I try to tell people, like, whatever you put in your body is so important, because you are what you eat. And your body, you could have an 80-year-old who's been eating, drinking Dr. Pepper their whole life and smoking their whole life, and they're fine. But we all have different genes, and each thing can trigger our gene to mutate and turn into cancer, So, now I've switched to all natural products. I use all natural hair products. Even some of the Maybelline blushes that you see has the chemicals in it that when you bind 2 chemicals, it causes breast cancer. And it's just, and it's crazy, even the sadness of the baby soaps. When you mix citric acid and sodium bicarbonate, when you mix those 2, it says it on there, like it mutates the gene, the DNA. So everything in our house has like dishwasher detergent, cleaning products, like no chemicals, because something like deodorant's a big one, because but when you're blocking those pores and the chemicals, the aluminum, that's a huge breast cancer causer right there alone.
Yeah.
And the thing is, I didn't know a lot about all this stuff,
Sorry, I'm trying to
I didn't know about all this stuff, you don't think like you really have to watch things, but you do. You got to watch, your toothpaste, your deodorant, you got to watch that stuff, because I didn't know that before. I had no idea. Like, nobody told me, hey, watch what kind of deodorant you're using. You just see, typical Crest, Colgate, or Degree, or, secret deodorant, and you think, oh, you know, that's what's on the shelf, that's what we're supposed to use. Like, no, like, that's not what we're supposed to be using. And I feel like we're all really brainwashed, and we all need to be educated. My neighbor is in school for nursing, and they tell you in her nursing books that fluoride is good for your teeth. And I'm just like, why are they teaching people this? Like, fluoride is a horrible thing for you to ever put in your body. You don't put that in your body. So
Yeah.
No,
it's really sad that FDA approved something with such chemicals because they're small amounts. They're not going to do anything. Lotions, toothpaste, cleaning supplies, and you're using all that daily. It adds up.
Yep. And the makeup and
that.
yeah, it's awful. Like, and another thing about the FDA too is Colgate didn't approve, or the FDA didn't approve something from Colgate. They said no. Colgate ended up paying them a huge lump sum, and they ended up approving it anyways. But that just goes to show you, like, a lot of this is all about like greedy and money, and it's sad because I don't know if are you in the cancer group? They posted a little baby going through chemo with his skin peeling off, and did you see it?
No, I didn't see that picture.
Maybe you'll see it. I'll tag you in it. But you know, there's a little baby going through chemo, and it's so sad. So
it is sad. And I know Autumn, I couldn't figure out how to echoing. So I've been trying not to talk a lot.
Oh.
Okay, so Kirsten, you just have one takeaway for people that you feel like they can start to empower themselves, something practical that they can start to take those baby steps to implement to be more aware?
Yeah, I would say there's an app on your phone you can get. It's called Think Dirty. And anything in your house, you can scan the barcode of the product on it, makeup or anything like that, and it will tell you every single chemical and if it's safe, moderate, high risk, whatever. And that was like my starting point. And anything that was like red with, you know, harsh chemicals, we got rid of. And that's a start. Is like starting to clear out the old, like when your bleach runs out, don't buy more bleach, you know. They'll recommend on the app like what to buy instead of it. Another thing is your diet. I don't have just one thing. I got lots of things. Your diet is huge. Everything. Your diet is your main thing. If you don't want to go vegan, fine, but stop the sugars, stop the GMO foods. And I know people, you know, think milk. You think milk, oh, I'm going to give my kid milk. I mean, I guess it's an opinion, but cow milk is so bad for, you know, when the way that they sell it in the store. We drink coconut, almond milk, and cow milk is how they sell it in the store is terrible. I mean, just the mucus alone that it has effect on the thyroid. And so, I mean, if you don't want to cut dairy, and I mean, red meats are also another huge red flag for your gut. And a lot of the cancer starts in your gut and it travels. But if you don't want to give up, you know, going vegan, and you can still do other things like look for things like organic raw sugar cane and things like that. And I know
there are a lot of tips you could get, but I feel like we don't want to overwhelm people.
Yeah.
So we'll probably just end right now that way. We can stop listening to this episode going on. Yeah. But if you have any last minute comments, I want to let you say
something. Prayer. Having a relationship with, you know, God, and that's a huge, huge thing. Definitely. To get through all this, you need it. You need God. Supportive family. One main support person, and You are what you eat. You are what you put in your body.
Very
Very
true.
true.
Yep.
Thank you so much for taking time to get on with me.
Yeah, sorry about the echo. I don't know what's going on.
Yeah,
I hear it. And sorry, you guys.
But thank you again so much.
Well, thank you for having me.
We need
stories like yours being shared.
Yeah, yep. And
So I appreciate
one last thing is your doctors will try to scare you into everything. My doctor told me that if I didn't have surgery by October 24th, my survival chances would be decreased. And in fact, just the opposite. So if you follow, a healthier lifestyle, then, I mean, they will, like, even now, he still tells me, I'm at risk and I need to get it out. But why would I go when I'm doing yeah, like, I'm doing so well, why would I chance that? So don't trust your doctors. Do your own research. That's the best advice I can give.
Yes. Be your own advocate.
Yep, absolutely.
All right. Thank you again, Kirsten.
Thank you. Bye.
Have a good night.
I don't know how to end this thing.
Bye.
Bye.